Hello everyone, my name is Tanya Phillips. I live in Medford, Oregon, which is located in Jackson County. So some fun facts about Jackson County is Ashland, which is in Jackson County, is nationally known for their anti-vax culture. So I've shown a graph which shows all of the immunizations that are required in the state of Oregon. So this is what is completed looking in 2017 school year. And so it shows all the schools that are in Ashland, and as you can see, none of those schools vaccination rates meet herd immunity. In Oregon, we also have legalized recreational marijuana, and another fact is that Jackson County and our neighboring county, Josephine County, produce 50% of the marijuana for the state of Oregon, and I'm sure we produce much for other states and cities. And also, In-N-Out is finally in Oregon, and Medford had the first In-N-Out, so we were pretty proud of that. I earned my undergrad degrees in health promotion and education, and then health policy and management from Oregon State University. And currently I work for Jackson County Public Health, where we recently became an accredited health department. And for Jackson County Public Health, I am their health promotion program manager. Here's a list of the different programs that I have oversight over, and so this is tobacco prevention, substance abuse prevention, accreditation, performance management and quality improvement, safe routes to schools, teen pregnancy prevention, problem gambling prevention, climate change, public health preparedness, and syringe exchange program. So on to the community health assessment. So health departments and state health departments that are going through the accreditation process, applying to or are now accredited, you actually have to have a community health assessment completed. So in 2013, Jackson County Public Health, we collaborated with Josephine County Public Health and 3 coordinated care organizations, which are health insurance companies in Oregon that have been given the authority to provide services for our Medicaid population, and they also control the dollars for that. So the state of Oregon Health Authority requires these coordinated care organizations to also have a community health assessment. And when you are an accredited public health department, you have to update and do a new community health assessment every 5 years. There were a lot of lessons learned, I know, from the first one, the community health assessment that we did, even though I wasn't directly involved, meaning I wasn't attending any of the meetings, I wasn't part of the focus groups, but because we were going through accreditation, I was involved in that way, so I heard a lot about what was going on through this process, and of course utilizing the community health assessment for data. So in 2017, we are currently working on the second community health assessment. This is even a larger collaborative effort this time around. So the goal is really to have one community health assessment for Jackson County. And so all of the different organizations that are required to have one, we would all collaborate. So we're just utilizing one community health assessment and producing one as well. Again, I'm not directly involved in this process, but we have our epidemiologist, and she is attending all of those meetings and providing that input. And so we sent our epidemiologist and our public health division manager to a MAP training in Phoenix, Arizona. So they are the ones really making sure that this time the process does follow the MAP process. And so again, that was one of the lessons that was learned. So community of choice is Jackson County, Oregon for me. At the county level, there's a lot more health data available. And so again, this is just how it's reported to the state of Oregon, and state of Oregon really looks at that data not on a city level, but on a county level. But also the other area that I would look at would be Medford, Oregon. And the reason for this is because there is data available looking at just Medford. And the reason for this actually is because Medford was part of the 500 Cities Initiative, which is a collaboration between the Center for Disease Control and the Robert Wood Johnson Foundation. And so they're really looking at the largest 500 cities in the United States and then breaking it down by census and providing prevalence and incidence rate on chronic conditions, but also prevention efforts and so forth. So again, that data is available, which then makes Medford an area that I would look at for this project. So my goals overall for the class are really to become more familiar with community health assessments and the process to develop these. I want these skills also so I can support staff in their work, especially as our epidemiologist works on our community health assessment. I want to be able to provide her as much support as she needs. Also just to support the accreditation process as a whole, and then again being able to take these skills and apply them to future positions that I may hold. So again, I just want to thank everybody, and I look forward to this class.